everyone, this is Dr. Abinaya Vijayakumar. I'm a doctor and a motherhood empowerment coach. For those of you watching me for the first time, I take positive pregnancy classes where I teach mothers how to stay active, happy and confident throughout their pregnancy and to connect with their baby using simplified Garbh Sanskar techniques, because your pregnancy is a golden phase of your baby's life. If you're missing out on this, you're missing out on something big. To connect with me to know more about the courses, I'll provide the links towards my Instagram page and my email ID in the description box. Do check it out and connect with me. Today in this video, we are going to discuss about what are all the things you need to take care of or start planning when you're preparing for a baby. Let's get started. First and foremost, let us discuss the fertility facts. In recent years, couples seeking fertility treatment have drastically increased 5 to 15% annually across the globe. This might be because of decrease in fertility due to work and lifestyle changes that we adapt nowadays, and it can be also because of earlier reach to the fertility treatments than waiting longer. So, what are the things that you need to keep in mind while planning for your baby? First and foremost, who needs fertility treatments? Most of the couples reach out to the fertility centers much earlier, but that's not needed, because you need fertility treatment only when if you are less than 35 years and you have tried more than 1 year of unprotected intercourse but still you cannot get pregnant, then you might need fertility treatments. If a woman is more than 35 years and the couple have tried for at least 6 months of unprotected intercourse but still have not got results of pregnancy, then they could reach to the fertility treatments. Otherwise, you just have to wait patiently and try consistently to get the results, because pregnancy never happens at first go for most of the couples. Luckily, some get pregnant in the first cycle, and for others it would be at least 6 months of unprotected intercourse to get pregnancy results. So remember these tips if you're planning for your baby, and also share it with your friends and family who are planning for a baby. First, physical activity. Most of the couple are very anxious to conceive, but what they forget is having a healthy pregnancy than just getting pregnant, because you can get pregnant, but if you are not healthy in the pre-pregnancy phase, during pregnancy with additional weight gain and immunocompromised state, you would be landing in many medical conditions that would pose increased burden to your pregnancy. Instead, as a couple, start with physical activity, become more fitter, and then plan for your pregnancy. It could be anything starting from walking, jogging, cycling, swimming, yoga, etc. Remember to start this as a couple, because this shows your commitment towards each other and towards planning your family. Number 2, if you have any pre-medical conditions like thyroid or diabetes or autoimmune conditions, get it treated and get it under control before planning your pregnancy, because there is always a chance that it can increase during the pregnancy, especially if it's a woman. So do reach out to your physician whom you're already visiting and take control of your pre-existing medical conditions. Number 3, basic workup for both men and women. For men, first it would be semen analysis and then your cholesterol levels, sugar levels and thyroid levels. For women, it would be basic blood investigation, which includes sugar levels, thyroid and hormone levels if needed. Second, it could be a basic ultrasound of the pelvis to rule out any polycystic ovaries, fibroids, etc. Prevention is better than cure. So after trying for many years and then not conceiving and then reaching out to your doctor might be very, very late. So if you're planning for your pregnancy, it is always better that you could do with a basic investigation, so that you can be rest assured that you don't have any medical conditions and you can start planning your baby. Number 4, any hereditary conditions in any of your families. Many of the times when we proceed for a double or triple marker test, or when the results come out and then we start discussing, the women starts exposing about the hereditary conditions in the family, which is not advisable. Hereditary conditions in the family or any history of Down syndrome or mentally retarded children in any of your sites has to be discussed with your doctor well in prior to the planning of the baby, because the couple has to be tested and the risk of the gene transferring to the baby has to be discussed well in prior. Number 5, conception of folic acid medications. I cannot stress this fact enough, because we already know that folic acid is vital for the brain and spinal cord development of the baby. So pre-conception phase, when you're planning for your pregnancy, it is always better to take folic acid at least 3 months prior to the planning of the baby. Not just the women, but the man can also take folic acid while in the pre-pregnancy phase. This would help in formation of healthy DNA for the baby, because 50% of DNA comes from father and 50% comes from the mother. So if both men and women start taking folic acid in the preconception phase, it would be much ideal to have a healthy baby. Number 6, getting vaccinated against certain diseases before planning your pregnancy. If the woman had not taken rubella vaccine earlier, or she did not have chickenpox in the childhood, or she had not taken chickenpox vaccine, she can take rubella vaccine and chickenpox vaccine well in prior to planning of the baby. When you take rubella or chickenpox vaccine, there should be a gap of at least 2 to 3 months before planning your pregnancy. Number 7, no over-the-counter medications while you're planning for the baby, especially in women. This also includes the medicines that you take for cold, cough, fever during the pre-pregnancy phase. So, always reach out to your doctor, especially gynecologist if possible, and then take medications for common ailments while you are in the pre-pregnancy phase. Number 8, balanced diet. If you are missing out on this, you are missing out on something big, because balanced diet is the basic of nutrition that the couple can have in order to form a strong foundation for your baby. If you're planning for your baby, then stop intake of all junk, packaged or processed food items and include more of veggies, fruits, nuts in your diet. Healthy nutrition in the pre-pregnancy phase is a great kickstart towards planning for your baby. So these are the common things that you need to keep in mind while you're planning for baby, and also share it with your friends and family who need to hear this today. And if you want to have a healthy, happy and a confident pregnancy and to instill the right moral values into your baby through GUPS and SCAR techniques, then you're always welcome to join me at positive pregnancy classes inside the Get Mommified Hub. In this course, we are not just teaching lessons, but we are teaching a lifestyle. This lifestyle has to be adapted by the couple in order to give the best life to your child, because pregnancy is a golden phase where 70% of baby's brain development happens, and this would be the best gift towards your baby's future. Join the positive pregnancy classes. Thank yourself for making that wise decision today. I hope you like this video. Do like, comment and subscribe to my channel and press on that notification bell icon so that you don't miss out on any new videos in my channel. Also comment below if you have done basic blood investigations and workup when you are in pre-pregnancy phase. I would like to know from each one of you. Until I meet you in the next video, stay happy, stay mommified.